living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
People living in rural areas are at higher risk from dying from heart disease, cancer, and injury than those living in urban areas. Many healthcare practitioners, organizations, and patients are working to improve health outcomes no matter where we live. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. When we come back, you'll learn more about these communities. Stay tuned. Welcome back to Healthy Living for Life. This morning, we're joined by Alana Jarman, who's Senior Account Manager with Mountain Pacific Quality Health, and Sabina Schenk, the Senior Project Manager at the University of Wyoming Center on Aging. She also serves on the Mountain Pacific Patient and Family Advisory Council. So thank you so much, ladies, for joining me today.
My pleasure to be here.
First question out of the gate, I would like you to tell a small amount about yourself. So I'm going to start with you, Alana.
Sure. So I'm a nurse by trade. I have my master's in nursing as well. Various experiences as a nurse in IHS, Indian Health Service, also with case management, risk management, utilization review, triage, inpatient, outpatient, including like specialty clinics. I've also been a nursing instructor for School of Nursing, and now I'm a regional co-lead for our Mountain Pacific team to support our community coalitions.
Thank you, Alana. So Sabina, it is your turn.
Thank you for having me today. So I came to this country about 40 years ago. I grew up in a community of about 1,000 people, very rural area, and moved to the San Francisco Bay Area to go to school. I got my master's degree in counseling and lived in the Bay Area until the last couple of years when I decided to fulfill my lifelong dream and move out to Wyoming. And did that, and now I'm working at the University of Wyoming as a project coordinator. And also I am part of the Patient and Family Advisory Council for Mountain Pacific Quality Health.
Oh, that's wonderful. Thank you, ladies, both. You clearly are passionate about improving care and working in communities. Alana, I'm going to start with you. I understand that we hosted a summit, and the focus of that summit was on improving health in our communities. So talk more about the purpose of it and how does it relate to rural health care?
Yeah, so we held two different state summits recently, one in Wyoming for all coalitions to attend, including all the members. And that was held on September 9th, and then the other one was in Montana. And again, that one was for all coalitions, and that was on September 21st. And so we wanted to bring our communities together, including our community-based organizations, such as senior centers, hospital staff, community support services, a lot of other folks that join those or were welcome to join those, and to talk frankly and openly about what matters in their communities. And we focused on key topics such as opioid and substance abuse and chronic disease management and vaccines. Just a few of those topics were discussed. And then we asked our community members, a few of them who volunteered to share their lived experiences. And we talked about ideas for solutions to issues that were affecting their communities. And so, as most people are aware of the benefits of living in rural communities, like knowing our trusted neighbors, we also know that there's challenges in those rural communities, such as access to care, whether it be from lack of providers serving that area or a distance to the healthcare organizations. So for states like Montana and Wyoming, where challenges we don't have a lot of control over, like terrain and climate, we also wanted to bring people together to have a collaborative conversation about what we can do together as a state and with Mountain Pacific as a region, really, to help start finding solutions to those challenges we have control over.
Oh, thank you, Alana. So as I understand it, there are coalitions like this scattered all over the United States. So that's great work. So Sabina, were you a participant in the summit?
Yes, I was. I was one of the panelists providing some feedback on all these subjects that Alana just talked about. And for me, it was really eye-opening to see how there's such a huge difference between rural needs and urban needs, and access, as Alana talked about already. Climate and transportation are huge issues. And it was very interesting for me to also observe what healthcare facilities and community centers are facing.
Alana, talk about how collaboration is important to healthcare improvement.
Yeah, certainly. So beyond finding really solutions to help improve workflow and processes for our healthcare organizations, we also know that our community members, we're all community members somewhere. We have to come together now, and really now more than ever, and just raise up and start joining forces to encourage and support and be collaborative with each other. So for example, in one of our Wyoming coalitions, they've elected to start working on a campaign to continue to show support for healthcare workforce. And I think with the climate that all this change has produced in the last 3 or 4 years, from politics to the pandemic, we need to get back to our roots again and see each other as beating hearts in ways that we can help, not hinder each other. So this coalition summit was really helping to start bridge those connections. And then with some of that work that kind of spun off from those summits was starting to work on projects. And so like that one in Wyoming was starting to show how kindness goes a lot further than any of us can imagine. And I recently read an article about the Billings Clinic staff have had to post signs in their hospital to help people remember to please be kind to one another, including hospital staff. So by coming together for whatever our purpose, the bottom line is that we go further together as communities.
So we've only got a few seconds left, but short answer, was the purpose of the summit to address rural issues, Sabina, or broader issues?
Really both. I think what we're doing is addressing broader issues and then really focusing on the rural challenges in all of that.
Oh, that's great. So we have to take a break, but when we come back, we're going to be talking to our guests again, and we're going to dive deeper into the summit, the purpose of the summit, what was accomplished, etc. So please don't go away. Stay tuned. Welcome back to Healthy Living for Life. So with me still are Alana Jarman and Sabina Shank, and we're going to be talking about healthcare topics that are of importance to our communities. So welcome back, ladies. Sabina, the first question I'm going to pose to you is, those living in more rural areas face unique healthcare challenges. Can you talk about that briefly and then pass the mic to Alana?
Absolutely. I think the biggest challenge for us is transportation, getting to the doctor's office. And for myself, a lot of times as a patient, I kind of wait and see if it goes away before I make an appointment, because it is burdensome to go and see my doctor because it's further away, weather conditions. And a lot of times I'm thinking, oh, I'll just tough it out. So I think that's our attitude in rural areas as well as other challenges. Alana?
Yeah, that's a really good point, Sabina. And, you know, although services are becoming more accessible from telehealth, increased access to those providers and specialty providers are still there. We still have a few challenges, like not having access to health coverage or money to pay for expensive things like medications for diabetes or other referral programs that may cost quite a bit. So it might have a high cost prohibitive coin to it. So, and there's also a lot of other services that maybe people aren't aware of either, like medication assisted treatment for opioid abuse. So there might be some knowledge gaps in more rural areas where services hasn't generally been available.
Good points. So a lot of people might not realize that promoting health in the community goes well beyond the hospital doors, for sure. So what other organizations and services are critical to discussions about rural health care? So Sabina, back to you, and then to Alana.
Okay. Yeah, I think, really it starts with our communities locally. We have educational communities. We have the university. I work at the university, so we can provide education around healthcare and health prevention of chronic conditions. We need to leverage our state health department and public health departments to provide education as well. And then there are organizations that are national organizations, such as Mountain Pacific Quality Health, who is really invested in improving healthcare in rural areas. We also have American Lung Association, the American Cancer Society, and so forth.
Yeah. Very good point, Sabina. And I think also, like, you made a good point with our local and state health departments and universities and their students, including nursing students. I'll put that plug in there. Also, we also like to see representatives from the service industry, like grocery store clerks and business owners, and also our American Indian Alaska Native organizations like Indian Health Service or tribal health departments, so we can get their voices in our work as well.
Ladies, let's switch gears and talk about the Health Summit. So Alana, I'll start with you. Can you share some highlights from the summit you mentioned?
Yeah, of course. So we began talking internally as a team at Mountain Pacific back around probably May, when we were starting to see the light at the end of this pandemic tunnel. And we thought it would be refreshing to be able to pull our coalitions together for an in-person summit. However, due to the Delta variant hitting us very hard, we elected to shift both summits for Montana and Wyoming to virtual to protect our communities and not put any more unneeded risk and taxes on our healthcare workers. So we also worked with our Patient Family Advisory Council, and as Sabina, being one of those amazing people to sit on that, we asked questions to them around topics such as, like I mentioned before, chronic disease management, vaccines, access, and hesitancy, and how to improve care coordination with communities. And so we wanted to hear their lived experiences, and this helped our collaborative conversation shift from what is the matter to what matters and start to work together for solutions.
Very good. So I'm going to switch to another question. It's related to COVID, and we're all tired of COVID. I mean, both talking about it and experiencing it, we know that. But we've got burnout and other community issues because of the ongoing pandemic. So Sabina, I'll start with you. Can you talk about those burning issues, what you're seeing?
Yes, absolutely. I would love to talk about that. What I'm seeing is that there is new information every single day, that there's conflicting information every single day, that we're being confused more and more and really don't know what and who to believe anymore. And so that fatigue sets in, where we really don't know which route is best for us. And I think in rural areas, even more so than in urban areas, we also have a mind of our own and want to do what's right for us and what we think is right, not necessarily what we're told to do. And so I think people are concerned about vaccinations. We've seen some vaccination hesitancy, not just in our general communities, but also among healthcare workers. And I think education and trusted education is really a very, very important part.
So we've only got about 30 seconds left, Alana, but talk about the flu vaccine. Are we seeing hesitancy this go round with flu?
Yes, unfortunately, we're still seeing some hesitancy around the flu vaccine. And I think that historically there's been either you get it or you don't. But, I think the education needs to be there so that we're well informed and we talk with our healthcare providers about the risks and benefits of it. So we continue to help educate and support the fact finding for both the flu and the COVID vaccines.
Thank you, ladies, both. We need to pause for another break, but when we come back, we're going to be talking about opioids and some other management of chronic conditions. So stay tuned. Welcome back to Healthy Living for Life. Still with me, Alana Jarman and Sabina Schenk, and now we're going to switch gears and talk a bit about caregiving and opioids and chronic disease. So ladies, thanks for hanging in there with us. Let's open with patient and caregivers. So you mentioned the Patient and Family Advisory Council before. How can community members get involved with that council in their community?
So every single community, oftentimes medical practices and hospitals, draw on the experience of patient and family care advisors or the council. And so if you'd like to volunteer, I think your first step for us in Montana, Wyoming, is to contact Mountain Pacific Quality Health or do a search around Patient and Family Advisory Council and see what's available. Also talk to your doctor. Oftentimes they may know somebody who would like to engage the family care advisors so they can connect you.
So while I have you, Sabina, we're talking about caregivers. Do you have any thoughts on what pressures they're facing given the pandemic and given all the pressure in communities now for burnout, et cetera? Talk about that.
Caregiving is certainly one of the biggest jobs that anybody can do because they often, caregivers, we have about 1 in 5 caregivers who are unpaid caregivers for loved ones. And caregivers are often in a sandwich generation where they're raising their own children, but also taking care of older adults in their lives. And so the pressure really is social isolation, feeling isolated, not knowing what resources are available for caregivers in their areas, and oftentimes assuming that in rural areas nothing is available. And that is really not the case. Start with your doctor and ask for help. I think for most caregivers that we're interacting with is they don't want to ask for help. They feel that there's some shame attached to asking for support and help as a caregiver. You're not the best caregiver you can be if you don't do it all yourself. And my biggest piece of advice really for our caregivers all across the nation is to ask for help before you need it. Because when you really need it, it's oftentimes too late. And then it takes a lot out of you as a caregiver, personally, emotionally, physically, and mentally.
Excellent advice. Thank you for sharing that, Sabina. I'm going to switch the mic now to Alana, and we're switching gears and talking about opioids. So we've all heard about opioids and the opioid crisis, and we've talked about it on our program before. What are we talking about, though, Alana, as it impacts the community? So give us a refresher on that around opioid use.
Yeah, so there is definitely a lot of conversation around opioid abuse and substance use disorder. And in fact, one of our anonymous lived experiences story shared during the summit involved a person with cancer. And from the metastasis of the cancer, there was a lot of pain experienced, both physical and emotional from that. And one of the points the person made was that they really needed pain medication because of the current opioid crisis. Many providers really are hesitant of prescribing. And so when we talk about pain medications, there's a various array of actual what we call opioids or a certain class of drugs, including illegal drug heroin and then also synthetic opioids like fentanyl. And then you would probably hear some of the other ones like oxycodone or OxyContin and hydrocodone or Vicodin, codeine and morphine, and there's a lot of other ones. So those are the class of medications that we're referring to.
So there's a stigma associated around asking for help and opioids. So are you talking when you think about it, about community stigma or stigma in the healthcare world, Alana?
Actually, I would say both. In another community event that a colleague and I conducted around opioid education, the community members that attended, we discussed that impact of being stigmatized for having a substance abuse problem, and how that has inhibited a lot of people from being comfortable about reaching out for help for treating their abuse. And, you know, as Sabina had mentioned earlier about caregivers asking for help before you need it, that's, you know, with substance abuse disorder, there's a lot of resources out there, but if you're feeling stigmatized, it's a taboo to reach out for help, then people aren't going to do that. And then as far as healthcare providers, it's become a little bit of a taboo to prescribe. So in that story of the cancer patient I was starting to talk about earlier, one provider that they had encountered had said to her mother, not to her, because her mom was in with her at an appointment, to quote, come to the fact that she has cancer and that she'll have pain. So instead of addressing her pain, he was reluctant to prescribe anything. And I think this type of mentality is wrong and destructive, but it's also part of the stigma that we have created in our healthcare system for creating that narrative around opioid abuse. So just like vaccines, we really need to encourage informative, supportive conversations to address this opioid crisis.
So Sabina, we've got 30 seconds left. Chronic disease, what are we talking about? Give us a quick list of chronic disease issues.
So chronic disease issues, diabetes, high blood pressure, high cholesterol, heart disease, cancer, depression are all chronic diseases that can really benefit from prevention and from management, and not just medical, but otherwise, you know, connecting with our community as well.
Wonderful. Ladies, I cannot thank you enough for joining us today. You shared great information. We didn't get to cover it all, but we're going to be back. So viewers, stay tuned. We hope you'll join us again next week. And until then, stay fit, stay well, stay healthy for life with Healthy Living for Life. Take good care, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.